All right, folks, we're back live again. Bob and Brad. Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we have the most famous physical therapists on the internet.
And opinion, of course, Bob.
Today, Brad, we're going to talk about hip arthritis or bursitis. We're going to talk about the two and what the difference is. And we're going to show you the top 3 ways to stretch, strengthen. Plus, we're going to throw in 3 tips to stop pain.
There you go, Bob.
That's the full package, isn't it?
It is. It's like the cornucopia.
All right, the way we run this thing is we usually go through our whole program first, and then at the end we take questions. And we'll do questions both on Facebook and on YouTube. And by the way, if you are watching the rebroadcast, please take a second to subscribe to us on YouTube.
Right.
And we provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also go over to Facebook if you're not there already and like us, because Brad and I, as children, were not liked, probably picked on, and now we're trying to turn all that way around. So
where'd you come up with that one?
I don't know. Plus, we're going to probably give away some free stuff in the next couple of weeks. So that's a lot of motivation there. All right, Brad, hip arthritis. Okay. Let's talk about that first. Yep. With hip arthritis, here I got a leg. I'm going to come on up here. How are you doing, Lonnie? Lonnie's handling Facebook there. So with hip arthritis, very simple. You have like a cartilage, a thin cartilage that goes around on this ball right here. And there's also some cartilage here, and it goes right in there. And after a while, that begins to flake off, wear through. That's what they call bone on bone.
Right. So when you walk, that joint is working and working, walking, running, etc., and it just wears through. And then you've got problems because you want to have cartilage on cartilage. It's a really shiny, really smooth when it's healthy, and it wears down and causes pain.
Right. It just grinds. And also, as you got to see my face. Also, as you know, as time goes on, it doesn't produce as much what we call synovial fluid, which is kind of a grease for it. Remember one patient called it snowmobile fluid? Did you ever hear that?
Yeah. Well,
it's synovial fluid. So anyway, that's hip arthritis, and you know, and with that, you know, the symptoms you're going to get with hip arthritis is a lot of times the pain, instead of being right here on the hip, is in the groin itself.
Sure.
Probably more often than not. It's going to be worse, obviously, when you do weight-bearing activities. So like stairs is going to be worse. You know, running uphill, walking uphill, walking downhill, all those things are going to be a lot worse.
You know, and in some cases, I've had a case where the hip pain, arthritis, literally referred pain down the leg.
Right.
And it actually kind of had some people, you know, the doctors as well as the therapists, they fooled us, but you know, usually that's not the case.
Yeah, it can be in a lot of different spots. The other thing you're going to see is a lack of motion. The hip is not going to move as far, and that's one of the things we want to try to restore. And so that's one of the stretches exercises that we're going to do.
Right.
All right, let's get rid of that, Brad.
Sure.
All right, now we're going to talk about bursitis. You got the bursa?
Oh, wow. I've got the bursa. This is an interesting.
Now bursas, yeah. Bursas are a fluid-filled sac, and they help, you know, muscles glide over bones and tendons glide over bones. So
this represents, and you can see this is a sac fluid, and there's a bursa on your hip right here, and this represents the IT band, which is a wide band like this, real tough tissue, and the bursa underneath that allows that so it does not go over the bone, and it keeps a nice lubrication surface there. And when that becomes inflamed, that can become very painful because the bursa has a lot of nerve endings in it. When it gets inflamed, ouch, it makes pain.
Yeah, and that's, if we want to be more specific, that's the trochanteric bursa.
Sure.
This bone here is called the trochanteric bone, greater trochanteric, right?
Yep.
And it goes right over that. So it's, the way you're going to often injure this is by falling right on the hip.
Sure, that can get it flared up.
The other thing, if you're younger, what can do it is if you're repetitively biking or running, see how that band is running across the bone there and how that could irritate it. The other thing is that what I see in a lot of patients, Brad, I'm going to back up for this one, is I actually see patients who have weak hips and they have what's called that Trendelenburg.
Sure.
So they're going like this one. Every time they walk, they kind of do the sachet.
Yeah.
That rubs harder on that bursa then, that IT band is. So if you're one of those people that walk along and you're kind of, you know,
you got that little
waddle, you really want to strengthen your hips. You're going to want to do the strengthening exercise we're going to recommend. because that'll stop that waddle, and then that should stop the bursitis because
Right.
it'll stop irritating.
Takes the stress off.
Yeah, and with bursitis, almost always the pain is right here.
Right.
Yeah, it's not here, it's not here. It's right on the point. You can push on it, and it's gonna be tender right there.
Right.
It's usually an easy one to diagnose.
Sure.
So, all right, let's first start off with the tips. Now, this is whether or not you have bursitis or arthritis. And I apologize if you're a younger person, but one of the ways to try to help calm things down, because things flare up and then they calm down,
Sure.
is to use a cane or a crutch or something to take some stress off the hip for a while.
Right. I mean, I've had people in their 70s and I say, I'm not going to use
Right.
a cane. But then I ask them to use it, say, just in here, and they'll use it and they say, boy, that feels about 50% better just taking some stress
Yeah,
off.
a lot of times, some people, Brad, this is what has cured them. I mean,
Sure.
it literally calms it down, and and I always find it interesting, not to pick on any of my patients, but they said, I don't want to draw attention to myself. So they'd rather walk like this than walk like this with a cane where they keep nice and straight. You know, I mean, but my mom's one of them. I hope she's not watching, but she thinks
Yeah,
it's
you
just
could be getting in trouble here, Bob.
she thinks it's just a sin to use a cane or a walker.
Sure.
So
The other thing is, if the pain's on you're going to use it in the opposite
and
hand.
use it in the opposite hand, correct? If you use a crutch, use it in the opposite hand.
Right.
There's a whole biomechanical reason why that is, and we don't want to go into that right now.
Right. The sequencing has to be the cane and the opposite leg go together. And we've got a video, a couple videos on proper use of a cane. So
Yeah. All right, the next tip, Brad, is your sleeping posture. Especially sometimes people have a habit of sleeping on one side or the other.
Mhm.
If that hip is painful, you don't sleep on it. I mean,
Right.
you just don't. I mean, if you feel like you have to be on your side, you can roll back a little bit and get more onto the buttock and maybe keep a pillow behind you.
Sure.
But, ideally, you're just going to get off that hip. And ideally, you want to maybe lay on the opposite hip. So let's say this is the painful one. We're going to go ahead and put a pillow right between the legs.
There you go.
And that's going to take some of the stress off that IT band, and even if it's arthritic hip, it's going to feel better.
Right. Yeah. It's amazing what that pillow does for people.
The other thing that this often works because it puts the hip in kind of a loose, non-compact position is to use the leg wedge.
Ah, yes. I've got it.
Oh,
right
there we
here, Bob.
go.
Say no more.
All right. And again, we always highly recommend this. Brad and I have a list of products that we prefer in our YouTube channel.
Sure.
In the description, it's called our Amazon list. This one's in there. A lot of people buy this one because they like it. I mean, it's just,
You bet. I've got one at home, and it's been a wonderful thing for my back, hips as well.
and I think what Brad said was to stay on another video was a really good idea. You can go to sleep with this and maybe sleep for a couple hours and then you just pull it out, right?
Right. Yeah.
So,
Yeah, because probably not going to sleep like that for
all
8
right.
hours.
Yeah,
But you
kind
can
of.
definitely help it cool down and take it out.
All right, Brad, do you want to set up the elliptical? This next one, whenever you have arthritis, by the way, arthritis responds to movement. Usually, especially in the earlier stages of arthritis, if it's not too far along, it's going to feel a lot better if you're moving the hip. I always still remember this. They did a study at Mayo Clinic. They had rabbits. The rabbits had arthritis, and the rabbits that they put on and kept moving their legs, their arthritis got better, and the rabbits where they put them in a splint and they didn't move, their arthritis got worse. So you want to keep it moving. So this one is good for arthritis. It is not good for bursitis. So I'm going to go ahead and move the camera down. And Brad's going to show, this is just an elliptical unit that we use. Oh, I still don't see it, do we? There we go. I got it, Brad.
Yeah, I got these dark pants and I've got to get my new workout pants with the stripes, but I'm just going to go along my femur so that you can really see that hip is moving.
Moving, right.
So right here, that joint has to be moving up and down directly in phase with this stick. So
Brad and I really like this unit. We've used this in our clinic for, what do we say now, 10 years?
yeah, I'm sure it's at least 10 years.
We had it in 5 or 6 of our clinics. And it just actually, it holds up really well. It's lasted for years,
Yeah.
but it's what, $80
Right,
delivered?
right.
Gives you free shipping on Amazon, so.
The big thing is we're moving the hip, but we're not putting weight through it.
Right.
And that's what we're looking for. You know, if you have a swimming pool and you're a swimmer, that's another great way to work with arthritic. Any of the joints,
yeah, exactly.
hips, knees, or ankles.
So this thing is heavy though, be aware of that. I got one for my mom, but she can't move it around the house. I mean, it's bulky.
Right.
All right, we'll put the camera back
You're
up.
not gonna put it in your luggage and take
No,
it.
no, no. You certainly are not. Okay, are we okay with that? I think so. All right, now let's show some of the stretches, Brad. I think one of the first ones, you know, it's good to stretch the IT band for bursitis, obviously, because that IT band goes right over the bursa. But it's good for arthritis too.
Sure.
To stretch it.
You're stretching that hip joint.
There's a lot of different ways you can do it. One way is you just cross your leg over like this, and then you pull up the other leg like this.
The old figure 4 stretch.
Yeah. So by 4, it means it's making a 4 here. So you can use the stretch out strap to help you with this if you want. This is our yoga strap. And you can go underneath this one like this to help pull it up. And it's got loops. You're trying to put the red out, aren't you, Brad?
Yes,
I know how you think.
Yeah, because otherwise gray on gray doesn't.
Like this. It helps pull up and stretch it like this. The other stretch you can do with the stretch out strap, get the IT band. And this is the one I do now, Brad. I just started this one.
Okay.
I stretch my hamstring. And again, you can put your hands in the loops here. And then you go over like this.
Sure.
And that gives a good stretch to it.
So you get that stretch across right where that IT band is.
I never did this one before, but now I've added it to my repertoire.
Yeah, that white represents the IT band.
You can also do it against the wall.
Sure.
I don't know if I can maybe just show it right here, Brad, if I had a wall right here.
Oh, yeah, it's too much work to bring it over here.
And then you lean your hips this way. I need to lean against something, Brad.
You want me?
Yeah.
Well, I'll pretend I'm the wall.
So,
I'm the wall.
now don't move. So I'm stretching the IT band, and if I cross this leg over like this, I'm really stretching the IT band. Brad, you serve as a good wall.
Right.
You did a good job.
You could do that with your spouse or, you know, someone who's willing to sacrifice themselves for you.
All right. How about this is the easiest one. This is one that, and this is a good way to tell whether or not you even have some arthritis in your hip. When you're sitting in your chair, just cross your legs and see how high that knee goes, how low it goes, really. So as I push down here, now compare it to the other side. Now, if you go to the other side and it's up like this, you're going to want to make sure that you stretch this one. So you're going to go ahead and with you in this position, leg crossed, you go ahead, pressure on, pressure off.
Oh, yeah.
This is the easiest stretch you can do because you can do it throughout the day. And it's really a good one for hips. What we have found with arthritis is that if you gain even a little bit of range of motion, that often decreases the pain quite significantly. So it just gives more room for that arthritis to spread the forces of that ball. So you really want to try to regain as much range of motion in your hip as possible, or even get a little hypermobile even if you can.
Sure.
So, all right, hip extension, Brad. A lot of different ways to do this one too. One way is you can just put your leg up on a chair, on a bed, and you can kind of lean forward like this and like this.
There.
And I'm stretching that hip now into extension. Showing up okay, Brad?
Yeah, I think it's showing up reasonably good.
You can also do it.
Your body's in the way a little bit, but I think people see it. I could do it here on the ball, although you have to be pretty agile to do it on the ball, but we're just getting that hip to come back this way, as you stay up tall as you can.
Kneeling way to do it, put a pillow down on the floor. This is the way I do it every morning. And you go ahead and go like this, and then you're going to go ahead and stretch forward like this.
Yeah.
It really stretches it.
Do the other leg, Bob, once. Then they can really see that direct hip motion. There you go.
This is one that actually needs it. This one's a little, give me a little trouble.
So that front part of the hip right in here is really getting that stretch that we're looking for.
Yeah, it works out really good. You can do it with the yoga strap too. You can strap your foot on and pull it behind you. I'm going to fall off the table.
Yeah, you be careful, Bob. You're not 25 years old.
Apparently not. So, all right. Why don't we go ahead and start doing some of the strengthening exercises, Brett? One of them is just, you want to take a chair and do some sit to stands?
Sure.
I'll take the ball, actually.
Throw the ball at him, Lonnie.
Lonnie, throw the ball at me.
Okay. Whoa.
All right.
Okay, so we're talking just simply
And this is strengthening the hip extensors and the big glutes and all that.
And it depends on the level of your strength. I mean, some people have a hard time getting out of the chair, particularly with arthritis. So you may need to push off, but you know, do the best you can with your arms. And then if you can do it, next step would be hands on your thighs and push up. So you're still using some arms for control and help. But as you get stronger, then you can put your hands together in front of you and work on that pushing up. And this is one of those things that after you do 10 of them, you're going to feel those quads working.
Yeah, we prefer, you know, Brad and I both like the ball on the wall. I can see I'm getting cut off on the, you want to push that camera over? There you go. There we go. And that way you can keep your feet way out in front of you and you don't put pressure on your knees. This is a great way to work the hip for getting into the, again, doing the squats.
Right.
So, all right, next one, Brad. Let's do hip abduction. You can do that also standing behind a chair if you're a little bit more weaker. Yep. Brad's going to go ahead and do it.
So the hands are here, give you some balance, and we're just going to think about good posture. So we're not doing this. Keep the trunk upright and out to the side. Don't point your toes out like this. It's very.
Yeah, I didn't see it. I just say you need to point your toes straight forward.
Oh, we don't have
So,
that.
Yeah, I can't see it very well.
Sure. But that's it. We're going to do 10 on this side. We're going to do 10 on this side. You're not going to flip it out fast. It's good controlled motion and work that hip right there. That's going to help that bursitis as well.
All right, Brad, I'm going to show two more. Why don't you start looking at comments to see if there's any comments. Another way to do hip abduction is to take the ball and you can go off to the side like this. This works out really good. You're actually not only working this one, but you're also working this one because it's providing support. And the reason I know that is when I flip over and do the other side, this one's already tired. So it works out really good. Straight leg raise to try to get the hip flexors. So you're just going to, very simple to do. Don't need any equipment. Just lay flat on your back. You keep this one bent, and this is the one I'm strengthening. And I'm just bringing it up and down like this. You want to make it a little tougher? You do a little shake back and forth like this at the end. A little turbocharging, they call that, Brad. So
yes, the old turbo.
This doesn't seem that hard when I start, but when you start getting up to 15 reps, you start to feel it, and you know, then you go off to the other side and do it. You got any questions, Brad, or I'll show a bonus?
Show a bonus.
All right.
I've got to come back a little bit here.
A bonus would be just doing some hamstrings on the ball. You can do it just by starting by just pushing into the ball and rolling the ball toward you. And then you can make it more advanced by lifting your butt up and bringing the ball toward you. And even more advanced by going one leg on top of the other. And the final one is to bring it all the way up like this. Very difficult to do. So how about you, Lonnie?
Well, she said she had pain from the legs of her thigh. It goes down to her toes.
Okay, if it's going all the way down to your toes, then I'm starting to think, you know, one of two things. Either, I mean, you got some type of sciatica. Generally, hip pain won't go all the way down to the toes. It'll go maybe down to the knee, maybe into the calf, but really unlikely unless it's you know, your broken bone. I would say that is more likely going to be a sciatica issue, and you'll want to watch. We just put up a couple new ones on sciatica, actually, or we're going to, and you want to watch that.
Okay, how can you tell if it's a bursitis or patella femoral thing?
Patella femoral is in the knee. So I mean, are they? I wonder if she's talking about. The question was, how can you tell if it's bursitis or patella femoral? And I don't know if because you can get bursitis in your knee too.
Sure,
and you can get patella femoral, which is under the kneecap itself. Now, under the kneecap, generally what we find is that if you tape the kneecap over, we have a video on this, look up our patella femoral. If you tape it over and it feels better, then like what we do is usually have people walk upstairs without the taping, and then we tape it and have them walk up again. If it's better, then we pretty much know it's patella femoral,
right,
as opposed to bursitis.
Mm-hmm.
The bursitis, especially like a knee bursitis, is often you're going to find a spot that's tender right underneath the kneecap.
Yeah,
that's one burst there.
Yeah, there may be that.
So you know, if you have your you have your kneecap right here. The bursa is going to be right below it.
Right.
If that's the question. What was your question, Brad?
Well, there's, let's see, Carrie Lynn's asking, she had
Carrie Lynn?
Yep, she had a labral tear surgery 5 months ago, so she's wondering if she should try these. And after surgery, I'm always a little hesitant to recommend because I don't really know what the
protocol,
the details of the surgery. So you really need to make sure, is there any precautions that are given? And so I like to say it's good to go to a therapist directly and get.
Or ask your doctor if there's any precautions. Well, how many months out was she? Did she say?
Well, she's 5 months out.
So
That's
for those of you who don't know, I mean, the labrum. If we look at the hip socket, let's come all the way up here. So right here is the socket. There's like a ring of cartilage that goes around here, and it helps hold that bone in. That's the labrum. And that can wear out over time with arthritis, but it can also wear out just from an injury. I mean, we see young people sometimes get that with a hip injury. The last person I had with it was a young guy in his 20s.
right. And the labrum is a slow healer.
A slow healer if it's going to heal at all. It's like cartilage, a lot of times it doesn't heal.
Right.
So a lot of times it does need repair. So.
Okay, Justin is wondering, he says, how long does it take for these exercises to improve? He says he's been doing them, but he's better, but not 100. Well, he's got 110%. But you may want to. I don't know if he's doing all of these.
Well, if he has arthritis, I mean, it's arthritis. It can improve, but it does not mean it's going to go away.
Right.
So
Sure.
I mean, you may have to tamp back your expectations a little bit because. This isn't miracle working. I mean, it doesn't make the arthritis go away.
Sure.
It just improves things and maybe stops it from getting worse.
Right.
So,
right. Which is pretty key.
Yeah.
With arthritis.
And if it does get worse to the point, then it's time for that hip replacement. So.
How about the pain? She have a pain below the artificial knee.
Okay, so Lonnie said the question is, a lady has pain beneath her artificial knee. So, I wonder if we know how long she's had the artificial knee. Knees last, what do they last, Brad? 10 to 15 to 20 years? Artificial knees.
Sure, right. That's what they're saying, 15 to 20. Although I've had a woman in her 90s, and her knee was over 30 years old.
Wow.
It was doing well, but that's
unusual.
They're not going to predict that.
So if it's a recent knee and you're having pain, underneath there, then you do need to see your surgeon and see that makes. But generally, I'm going to say as a rule of thumb, I mean, when they put those components in there and they glue them in there,
right,
they're in there.
Yeah.
I mean, I don't know that I've ever seen a component loosen like right away. I mean,
right.
It might after 15 to 20 years.
Right. I had one person that did have her. Some of the components loosen up, but that was once, and I've seen hundreds of thousands of knees.
Yeah.
They're good at knees.
Yeah.
They've been doing them for.
They're good, and that glue is solid right away. Right. When I watched the surgery, they even gave me a piece of it. It heats up that glue, and it's solid the second they leave that surgery.
They got that pretty well down pat.
Yeah. So, Bonnie,
Okay, he's asking what exercises, his wife is 30 years old and she had Pes bursitis in the right knee.
Pes bursitis, okay, Pes Anserine bursitis. So with Pes Anserine, that's on the inside of the knee. So 3 muscles come together and they form like a goose's foot, they call it. That's Pes. And it irritates right here. One of the big things you're going to want to do with that is make sure you're doing a stretch like this. You want to stretch those muscles on the inside so that that you can put less stress on that Pes Anserine.
Sure.
You can ice it. I don't know if that using a gait aid is going to help with that, would it? I mean, the big thing is you're going to want to keep it stretched.
Sure.
So
right.
that it
and again, that's one of those things. Find out the activities that really seem to irritate it, and either have to modify them or don't do them for a while. Take a break if that's possible.
You should be able to get it calmed down. I mean, but keep it stretched. And it's one of those things that beyond that we can't really give advice without looking at you, without knowing.
Right. Yeah. We're kind of limited over the internet.
We'd have to see how you walk and what there's something unusual about that.
Right.
And such, so. All right, Brad, Lonnie.
Okay, I have partially torn gluteus medius tendon.
Okay.
Pain in the left hip, how do I?
Yeah, that's a good question, because a lot of times people think they have bursitis and it's actually a gluteus medius tendon that might be tore. Now, it depends again how bad it's tore. Generally, a lot of times I like just doing some cross fiber massage over that area. So you're gonna, you can take your hand or you can use some device and you're gonna rub on the tendon, and that helps get more blood flow to the area and helps it heal quicker.
Yep.
So we also use do you want to grab the Pure Wave, Brad, real quick? We're big fans of this massager. It's down in our preferred list. It does percussion, and it's got different settings, but you can go right over and work that across the tendon and help it heal quicker, get more blood flow to it.
Over the Pure Forms?
No, she had the gluteus medius.
Oh, okay, sure, right.
And again, you can do it with your hand too. You're also going to want to protect it with a cane. Use a cane on the opposite side to help it heal quicker.
The forces off. One question was, and it's a good question. Why is the elliptical, the bike that we were sitting on and pedaling, why is it bad for bursitis, but it's good for arthritis?
Yeah, very good question. And it's the same reason a lot of times bursitis occurs actually, is that IT band, when you're biking or moving the hip repetitively, that IT band is rubbing across the bone, across the bursa here constantly. And so it actually irritates us. So we see a lot of bikers and a lot of runners get that.
Yep.
And so you don't want to do repetitive stuff when you have a bursitis.
Yeah. This is quite a model we have here.
Yeah, we're doing really high tech, aren't we?
We worked quite a while to get the good model. That's a hard one. Sorry about that one.
Any other questions on Facebook, Lonnie?
Well, she's just asking, are those exercises appropriate for piriformis muscle?
For the piriformis muscle, the big one you want to do that is the piriformis stretch, without a doubt. And the way you do that, and again, good question, because the piriformis is pain in the back of the hip. And a lot of times people mistake that for arthritis or for bursitis. But you bring your leg up, and then you're going to bring it over and bring it to the opposite shoulder. Sometimes people cross their leg over like this and bring it over. But you want to really stretch that side. That's one of the main things you're going to do. We've got other videos on other things you want to do, but that's the stretch you want to do for bursitis. I mean, for piriformis. And you're going to find out if you try it on the other side that this one's tighter, the one's the side that you're having the pain in. So,
someone, it was chaos. I don't know if it's a male or female, or he or she was asking his mother had a hip replacement 30 years ago. She's 90 years old. Should she be doing any of these? Boy, at that age, a 30-year-old hip, that's something you really need to go to a therapist directly. Yeah. We can't give information on that.
Always keep walking as much as possible, I would say, without a doubt. But it's, you're
going to have to listen to her body. If it creates pain, particularly sharp pain, stay away from that activity.
Good for her, though. 90.
Right,
that's good, bro.
Sticking in there, good, really.
All right, Lonnie, any other on Facebook, or are we going to? How about one more?
Okay, exercise for bursitis hips. You have a bursitis in your hip.
That's
what exercises.
Yeah, if you have to go, if you're on Facebook, just rewind. Well, I mean, go over not to. Well, it'll be on Facebook again. You can watch it again.
Sure.
And also, or on YouTube. And we just went over all the exercises.
Yeah, just go back a few minutes and you'll see.
Yeah, if you just came aboard.
We're showing some of the stretches and some of the strengthening exercises for that.
How about pinched nerve in the leg?
A pinched nerve, that's again a whole different animal. Is the pinched nerve up in the back, or is the pinched nerve in the piriformis? We don't know which one. Those are handled differently. We've done a lot of videos on that. Just type in.
That's a sciatica. We typically covered that with.
Or false sciatica.
Yeah, right. So that's a good question, but it's a little bit from a different source.
All right, we better wrap it up, Brad. We got to go to work. So.
Yeah, exactly.
All right. Thanks everybody for watching.
And have fun.
Behave.
Careful, behave.
Yeah.